Hi, I'm Dr. Michelle Gaines.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today, you're going to be talking about utilizing Lexapro during pregnancy and the data that we have to support or not support its use.
When we say Lexapro, that's the brand name of the medication. The generic form is Escitalopram, so for other countries, it might be called something other than Lexapro. I think it would be helpful first to also mention that Escitalopram is a part of citalopram, which is the brand name Celexa. So some of these studies that we'll be talking about were focused on Celexa and citalopram and escitalopram. Some were just focused on escitalopram, some on citalopram. So we'll kind of be mixing and matching a little bit.
So getting pregnant on the class of medications as a whole, the SSRI class, there might be a small decrease in fertility or ability to have a baby.
And that's just based on one study. And I think from what I can recall, there's other studies that have not shown that association. We need more research, basically, to know is there an increase or decrease risk in fertility with taking SSRIs as a whole.
I think in that one study that found that when you tease out and look just at escitalopram by itself, that it did not find that it was significant enough to say it can reduce your fertility. So I think it's important.
Yeah, so escitalopram was not associated with a decreased risk.
Not being able to get pregnant. Also, just this class as a whole can decrease libido. So that's just like a side effect of the class. And it's very person specific. So that might impact your ability to get pregnant if you just don't want to. Yeah. So let's talk about if you are pregnant and you need treatment for depression or anxiety or something else that you would use escitalopram for, what are the things that we would discuss with our patients?
So miscarriage.
Yes.
Risk of miscarriage. It has not been shown to increase the risk of miscarriage, but I think that was just in one study. So again, we need more research on that to determine if that's true or not.
Mm-hmm. So what about birth defects?
So with birth defects, I think this is an excellent example of how important research, having an abundance of research is when we're talking about risks of medications or risks of an illness or whatever, is that if you just look at one study, you're not going to get the whole picture, right? So for example, with escitalopram, there was one study that showed no overall increased risks of malformations, but there was an increased risk of AV septal defect, which is a defect within the heart. But then there were 5 other studies that showed there was no increased risk of AV septal defect. And so with research, we want to look at the studies as a whole, what's been able to be repeated more in research, and that's how we kind of make the decision on, okay, is this real or not? And so, like I said, with the AV septal defect, that was in one study. One small study also showed an increased risk of clubfoot. And then we have several other studies that have used a lot of participants and have also kind of looked at parsing out what is the indication. Are they depressed, or are we looking at just controlled healthy people? And they show no increased risk of any kind of malformations, cardiac malformations, or anything like that.
I think kind of moving on from birth defects to the next thing is like when the baby is born, how well do they do? I think there's a little bit of information to support that the birth weight of the baby might be a little bit higher on someone who is taking Lexapro or Escitalopram.
One study showed that. And then there was also research on neonatal adaptation syndrome,
which we know is for this class of medication is a known risk. Okay, so neonatal adaptation syndrome, when I explain it, essentially I think of it as just an ability to, or difficulty in adjusting to life outside of the uterus. That a baby might be a little bit extra fussy, a baby might have difficulty with sleeping, or a little bit of difficulty with feeding. For the vast majority of cases for babies who have neonatal adaptation syndrome with this class of medication, they do not require significant intervention. They don't generally have complications longer than, a very short period of time, a week or maybe two, and that it goes away on its own.
And I think research supports that, in that there have been studies showing that there's no increased risk of NICU admission, so baby having to go to the ICU after they are born, and when you're looking at babies exposed to escitalopram versus babies who were not.
What else?
Premature birth was not increased. No. Persistent pulmonary hypertension of the newborn is something that's kind of been, I guess, mixed. It's one of those things where some studies show that there is an increased risk, other studies show that there's not. When we look at the research as a whole, it seems that maybe there is an increased risk of this, but it goes from 1 in 1,000 in the general population to about 2 in 1,000 in babies exposed. So while it is statistically significant, meaning we see it in the data, it doesn't necessarily pan out to be clinically significant. I think it's important to mention too that mental illness, particularly depression in pregnancy, has been studied in research, and consistently in research we see that increases the risk of miscarriage. That also increases the risk of preterm birth. It can also increase the risk of baby having some issues adjusting after birth. And we also see that in some small studies, they've looked at actual brain development between infants who were exposed to depression in pregnancy versus infants who were in a healthy environment. And those infants who were exposed actually had changes in their amygdala, which is the part of our brain that's focused on reaction and emotions. And then we see that play out in real life, and that children are more likely to struggle with emotional and behavioral disorders if they've been exposed to mental illness in pregnancy.
Mm-hmm. So, we generally recommend someone has some kind of treatment that does not have to include medications, but for the people who need it, we definitely think that escitalopram is a reasonable option. For me, when I'm talking to my patients and I see them struggling on a day-to-day basis to enjoy their life, to manage their health, to be present, to do all the things they want to do to get the care that they need during their pregnancy, and they need treatment, I do consider escitalopram to be a very reasonable option during pregnancy, either if it's worked for them in the past or nothing else has worked for them in the past. And of course, I can't give advice to any specific one person if they're not my patient, but I think the overall totality of the data supports that it's not super risky and that it can provide significant benefits in the way that we feel and the way that we're able to get care and enjoy. And yeah, let us know what other medications you would like to know about. We have a couple coming up, so stay tuned for those. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.